Good evening, all. Welcome to today's Zen Living session. Myself, Annie Jose from the Community Outreach Team of ZenOnco.io and Love Heals Cancer. Today, we have a Zen Living session on post-treatment health and strength for cancer patients with Vartika Mehta. Welcome, Vartika Mehta, for today's session. So, she is an integrated nutritionist and holistic and lifestyle coach with 14 plus years of experience. She graduated from IIN New York State University with various other degrees such as Masters in Food and Nutrition and PG Diploma in Dietetics and Applied Nutrition. Vartika is a certified yoga teacher registered under Department of Ayush, Diabetes Educator, and certified in Garbh Sanskar, Pre-natal and Post-natal Yoga as well. She offers yoga and lifestyle workshops for corporate groups and one-on-one coaching for diet and counseling, weight management, diabetes management, nutrition for children, hormone management, and nutrition for fitness and exercises. Her experience and achievements include lifestyle and dietary management for people who have diabetes, obesity, varicose veins, PCOD, thyroid disorders, pregnancy and lactation, and mental health issues. She has conducted various workshops in the High Commission of India, Seychelles University, etc. She got featured in multiple newspapers like Hindustan Times, Midday, Rajasthan Patrika, and Mind, Body, Soul magazine, etc. She is also an author of the Moody Princess published in 2018. So once again, welcome to today's session, Vartika.
All the parameters are in range. Do you think you're healthy? You could have packs and you could lead a very, very active, healthy life. But if you are consuming alcohol every day and or consume, say, Diet Coke every day, you think you're healthy? No, right? Because all these toxins are slowly affecting your body and then leading to one or another disease. It affects our DNA and also the cellular metabolism. So we all know that cancer is a multifactorial disease, and therefore we need to address and work around all these factors which are associated with that. So now let's talk about the integrative approach towards any kind of disease management. Here we incorporate our mind, body and soul in combination so that the healing process not only becomes faster, it is also long lasting. We can pop 100 pills, we can take X medication, but what if the system is not clean from inside, our mind is not clean from inside? Then this is not going to work. We will eventually find side effects of all these medications and fall even more sick. Okay, I'm not against all these medications. These are again important because medications have proven, especially during the pandemic, it has been proven that they are helping us in fighting these infectious diseases. But is that the only solution? No, right? When it comes to strength and health, we all need this integrative approach because we are not just our physical self. We are a combination of mind, body, as well as soul. We need help when it comes to our relationships, our joy, creativity, spirituality, food, sleep, exercise, rest, etc., etc., etc. The list is absolutely endless. Basically, name the area. It has to be healthy. If it is not healthy, it will create toxins in your system and it will make you even sick. This is what we call as psychosomatic disorders. So only when we are healthy, we could be strong. Now, strength is not just physical strength. It is mental as well as emotional strength. You could work out in the gym and gain those 6 packs and have like good muscles and everything. But you can't be strong. Your immune system can't be strong if your emotional strength is poor. You'll keep on falling sick. If your mental state is weak, you will keep on falling sick again. And I'll tell you how these all things are very, very closely related to your well-being. Okay, I need not educate on how cancer spreads because everyone in this room I think they know more than me what cancer does and how it spreads. But let's just move back to integrative approach. So this approach is a very, very beautiful amalgamation of all the areas of our life, which includes optimum nutrition based on your specific needs. You're focusing on your mental health, well-being, your habits, your sleep, rest, exercise, basically becoming mindful and aware of our day-to-day living. We need to make those small little specific changes to improve your health and well-being because we need it to gain that energy, to gain that immunity, to gain that strength. Only then we will be able to regain the strength back, or probably come out of any kind of disease even stronger than before. So, coming to the smallest particle of our body, cell, we are all made up of energy. Let's talk about a little bit about quantum physics here. All of us are made up of matter. There was a big blast in the universe, and small particles made all of us. And so we have the smallest particle from the universe within us, and this is how we were formed. And even quantum physics says, even our shastras say that we were all formed with this. It is not hypothesis, this is the real truth. So now this energy, in simple terms, is regulated by our environment, by the food that we eat, the way we sleep, think, and move. So feed this energy right food and we are sorted. So with chemo and radiation therapy, the energies from the cells is not only depleted, it is also not in an appropriate frame for our well-being. And that's the reason why, because of the side effects of chemotherapy and radiation therapy, or otherwise also, people experience a lot of fatigue, weight loss, low energy levels. Specifically, if I talk about chemotherapy, this is a mandatory thing that happens after chemo or radiation. Boils in the mouth and change in the perception of taste, disability to eat. We can't eat properly. Sometimes it's because of the surgery, there are changes in the physical body and all of that. So at that time, now see, we are in such a state where our body is anyway very, very weak. Okay, because of the medications, the toxins, and the overload on our system, on our internal organs. So a lot of physiological and psychological changes are anyway happening in the body. Now at that same time, if you don't feed the body with the right fuel, what will happen? We will even go down with our health, with our strength, with our immunity, with our energy levels, and everything. And one thing leads to another. If you are physically weak, you feel mentally weak. If you are mentally weak, you feel physically weak, emotionally weak, psychologically weak, and everything goes round and round, and we are trapped in that vicious cycle. So all we need to do is bring that prana shakti back, that force, that life force, the prana, which regulates our body, our mind, our soul, and create the right environment for the body, the cells of your body, and see how we thrive. We are the ones who have conquered the entire universe. We have reached moon, we have reached everywhere. So we are capable of doing anything. Human mind is capable of doing anything and achieving anything that they want, but if we are on the right track, only if we provide right fuel to ourselves, then only we'll be able to achieve what we really want. So I usually call it as AV, which is Ahar, Vihar, Achar, and Vichar. Ahar is, of course, food. It's not just what to consume, it is when to consume and how to consume and what to eat and how to eat. Vihar is our rest and recreation, our sleep. Achar is routines and patterns of a lifestyle. And Vichar is our mindset, the positive thoughts, the goals in our life, our school of thoughts. And they all are making us. They all are making us. We are not just this physical self. There is a soul inside us. There is a mind inside us. There is a heart inside us. And all these things make us as an individual. So we need to work holistically on all these areas so that we are leading a healthy and a happy life. What is the ultimate aim of human life? To lead a very happy, healthy, successful. I think at the end of the day, we all want this from ourselves, that let's be healthy and happy and successful. Again, there is no benchmark for being successful. You are able to do a particular exercise, you find that okay, you are successful. If you have become a CEO of a company, you think that you have become successful. So there is no one definition of being successful. But yes, small baby steps, whatever the target is in your head, will make you feel that you are successful, right? So that is the ultimate aim of our human existence, and we want to achieve what we want, and then we are happy with that. And of course, progress is something that we always look for. It is all about progress and not perfection, because nothing is perfect on this planet. All right, so coming back to the main topic of gaining strength post cancer, it is not just about getting into a particular kind of diet or taking supplements or taking medications, or I would not say that you pop this bhasma or this Ayurvedic pill. No, it's not about that. Well, these things may help us, but our focus should be on our AVAV, that is our lifestyle, ahar vihar achar vichar. So while you must all be bombarded with ample information about ahar, that is food, and you should eat this and you should eat that, but I must tell you that yes, we should bring the attention back to eating wholesome food. Just one rule that one should follow is eat wholesome food. Any processed food is not good for our own body. Okay, so anything that comes out of a packet should be a no-no. So a lot of doctors, I'm very sorry to say, and I feel very bad saying this, but a lot of doctors say that eat whatever you want to, you just need to gain weight. Okay, but that should not be the case. Weighing higher on scale doesn't mean that you're healthy, right? Doesn't mean it. You have to have a good body composition. I would not say perfect body composition, because there's nothing called perfect here, but a good body composition is something that we need to look into, not just gaining weight on scale. We need to build our muscles and not fat, because fat again increases the cancer risk. So even if we let go, say, chalo, I let go the high fat and refined flour in the food that we are eating, which is coming from those packets and processed food like those bagels and those chips and those bars that we got, energy bars and all of this. We should consider that these foods are not very nutritive here, because they contain preservatives, they contain chemicals, and even if they're labeled as high protein and high fiber kind of food, they do more harm than good to our bodies. Now, these food, first of all, don't give you ample antioxidants, okay, which are needed to fight the free radical damage that has been happening in our body. Okay, so that is one thing. Then another thing is that these preservatives and chemical overburden the entire system. See, anyway, there is the drugs that we have taken because of chemo and radiation and all those medications that have gone inside the body. Our liver and kidney and lungs are trying hard to throw the byproduct, the toxins out of the body. Now we bombard our body with these chemicals again. What will happen? Will our body be able to throw it? No, right? We won't be able to throw it. How much a body, then after a point body will say, boss, I give up now, you do your stuff, I'm not going to help you here, right? So let's start crowding out food that no longer serves us. This will give room for consumption of those foods which are actually required by our body. So that doesn't mean that you start getting scared again. Agar ek biscuit kha liya, if you've eaten one biscuit, then you shouldn't be thinking that, okay, eating that ice cream or that biscuit will make me sick. But what we can do is follow a 90% and 10% rule, that at least 90% of the time we are eating a very disciplined and a healthy diet, and 10% we could indulge in some of these things. This is possible. Then slowly you could see, once you understand that your body is very happy with that wholesome and healthy food, you will automatically reject those unhealthy stuff. It is all a vicious cycle. You eat salted and sweet food, you crave for more, and then you again eat more. So this cycle keeps on continuing. Once you break the cycle, that's when you realize that, okay, I don't even want such kind of junky food. I feel more happy when I eat a banana over that packet of biscuit. Okay, so these things your body will tell you. Just listen to your body. Try this rule and then listen to your body. Your body will start giving you signals that this is what you want and this is not what you want, right? Don't get scared. Eat fearlessly, eat without guilt, see what works best for you and not just for your taste buds. Also, we need to draw some boundaries when people give you information on what to eat and what not to eat. Stop researching, stop scrolling, accept it and then move on. Stress and fear is something that has never been measured by scale, the way we measure our weight. And that's a reason why we fail to understand how it regulates the entire body system. Just because we are stressed, the way we eat, digest, and even assimilate food gets affected. It affects the availability of all the nutrients. See, all I'm trying to say here is understand yourself, and your stress. Of course, some amount of stress is good, which will keep us motivated and serious towards our goals. But if this stress is constantly bugging you, constantly haunting you, and affecting your own daily chores, your goals of life, we really need to address it. So again, a very, very important tool here could be journaling. You're stressed, you're feeling negative about things. Start your day with writing 10 positive things that you are grateful for. One of the very, very fine technique is reflection. What you could do is at the end of the day, sit and observe your entire routine with your closed eyes, sequence by sequence, one step at a time. I woke up, I had this, I did this, and observe it without getting attached to it. Look at the things objectively. Now, when you look at those things objectively, you will soon, first of all, it will improve mindfulness, because we usually become very, very mindless when it comes to, doing things. We don't even realize what we have done. So it will improve mindfulness. It will also enhance your memory, your concentration, your willpower, your determination to do things. But at the same time, you will also not feel fearful, because you are detached. You have just observed it like a movie. You're not stressed about what has happened. Observe each and every event like a movie, and that's it. You are done. Now, slowly and slowly, when you're mindful enough, you're aware enough about yourself, you will stop feeling stressed about things. And of course, those positive things always have a positive impact on your lifestyle. Also, remember, you are not the one who runs the world. All you need to do is do your best. Give your best. I'm thinking about that shloka that was there in Bhagavad Gita, which said, "Karmanye vadika raste ma phaleshu kadachan ma karm phal hetu budmote sango sattva karmani." That means you need to only do your duties well. Do not think about the result. The moment you start thinking about the result, you are trapped in the entire process. So stop thinking about the result. Just keep on doing your duties towards yourself, towards everybody around you. I would not consider any one of you in this room weak, or any person who has survived cancer is a weak person. A person who has fought it is a very, very strong person. So you are responsible, you are strong, and you can do it. Acceptance will help you find the solution of your current issues, and you will definitely find yourself in a better frame of mind. This is actually empowering, and I would say this is strength. This is strengthening. It's time to get your back. You have got your back. So at the same time, we also, coming back to exercise now, food is one part that we need to look into, but exercise is something that will help you gain that strength, because more you tense your muscles, more they are built. It's very simple phenomena. Break it to make it. So we need to build muscles, and for that, the only way is exercise. Build to strength training. So your exercise should be always a combination of cardio, where your breath is puffing and puffing, and also strength, where you're using your muscles. So again, yoga is a very, very great way. You could always, if not performing yoga asanas, you could always do strength training in combination with, say, running or jogging or walking. Again, this could be a very far-fetched thing for you, so don't worry about it. Start slow, one step at a time, one thing at a time. You need to just make sure that you are taking baby steps and then progressing. It is all about consistency. A very funny thing comes to my mind is that, our minds are like monkey, which is bitten by a scorpion. So imagine a mad monkey. What will it do? So what you need to do is tame your mind, control it, because our mind is full of imagination, and that is the reason why we are able to create and think and create, and we are also able to destroy. So it's our nature as human, because we perceive things very, very differently. For some people in this room, this webinar could be very useful. For some, it will be like pointless. What is she talking about? It's a waste of time, So it could be just information. It could be resonating with some people, or for some people, Vartika could be wrong. Okay, ultimately, that nothing matters. Okay, she's just talking rubbish. So anything, it could be anything. The way you perceive at things. When you look at a glass, it could be half filled with water, and some people would say that okay, this is half filled, and some people would say that it is half empty. So both people are correct in their own way. What we need to understand is that everybody has their own perception, perspective, okay, and everybody is correct in their own way. So the world may be treating you a very different manner. It is not just because you have cancer, but because you are very individual. A different individual are they're different, they think differently, they act differently. But what happens is, when we are physically stressed, when we are in a state where a disease has already hurt us, we somehow become very mentally weak, very emotionally weak. Why me, why did this happen to me? And at that time, we are in such a vulnerable state that anything would perpetually hurt us. So I would say a lot of people around us are very emotionally disturbed. Whether they have cancer or not, it's a very different thing, but most of us are very emotionally disturbed, and now this kind of emotional stress is leading to again different kind of diseases. So when we talk about that vicious cycle, you're round and round to that. So remember, in the beginning we spoke about right environment to ourselves. So emotional trauma have very long lasting effects, and this gives us a body, the environment where these cells can even thrive, these cells flourish, the cancer cell I'm talking about. So we need to work on our emotional well-being as well, because our hormones are regulated from our mind. There is a pituitary gland, and it is a master gland. It instructs all organs to secrete the hormones in our body. And what happens is, if the mind is constantly stressed, the energy itself is lost, and then you have this one. The third aspect of dealing with people is Karuna. Now, again, understand, Karuna is compassion. Now, those people who are troubling you, who are constantly not being nice to you, they themselves are troubled, and that's the reason why they're creating a lot of nuisance around. A sane person, a positive and a peaceful person would never create an environment of suffering. So people who are, say, vengeful, people who like to hurt you, they themselves are disturbed in some or other way, and when they are disturbed in some or other way, they will do the entire thing. So just treat them with compassion. These people don't exist for you. You don't have to hate them, because if you hate them, it will burn you out. Be indifferent. It's difficult, but as I said, your mind is so powerful that once you control the monkey no, you are done. So that could be one way where you could go through that metamorphosis, that transformation of thoughts, and be in a very positive mindset. Sometimes what happens is, it's our own ego that doesn't allow us to let go. Yes, it leads to Adi. That is okay. Now, what are those diseases? It could be sleeplessness, it could be anxiety, it could be depressive feelings, negative self-talk, etc. Now, this leads to disturbances at physical level. Okay, the physical body, which persists for very long duration. Okay, and if it is there for long duration, it will cause vyadhi. That is diseases. Now, those were just symptoms. There will be now disease that is appearing in a physical level, and we know that one thing leads to another. We need to just understand the chain reaction that happens within our body. So now what we need to do is give antidote to this. We are doing all the things that will give our body artificial light. Now, if you are giving your body artificial light, your body is confused. It is not understanding what it really wants. And again, this is one reason why you're not able to sleep well. There could be a lot of other reasons. For example, amount, if you're socializing overly. So these all factors affect your mind, okay, and they don't let you sleep because those thoughts keep on running. Your mind is at constant work, and that's the reason why if your mind is not rested, you can't sleep. Sleep resets the system. So if you really need to recover, you need to sleep. If you don't sleep, your body will not be able to recover. So again, bring your attention back to you. Now, we also here need to understand that, we are our priority and nothing is more important than what you are. I'm not asking you to be self-centered or, selfish, but a lot of people call it discipline. I call it self-care. It is all same, you need to get into that frame that yes, I am important. It's when you put others before you is where you suffer. You get into this trouble of not being disciplined, or maybe you're not able to prioritize. Again, you don't need to beat yourself up with this. Just start taking small baby step, one step at a time. You're good. If you're doing this, you're good. You're prioritizing. One just needs to keep going. So now, coming back to exercise, first thing is that you need to take a note from your oncologist, because of surgery and everything. You need to get a nod from him or her, and then you can move on to this pathway of exercise. Now, yes, I'm weak, I'm not feeling energetic. So what you could do is start with taking baby steps. Again, do mild stretches in the sun, so that your body is activated, it is getting the enough the nourishment that you're supposed to get. Do 10-minute walk, 5-minute walk. You don't have to hit the gym and pick up 10 kgs weight, or you don't have to do that. Start slow, slowly your stamina will improve. Now, I have had a person whom I was coaching, and she was very lethargic. After one Surya Namaskar, she would fall, she would just collapse. But eventually, when she was consistent, she could hold a plank for about a minute. Now, this is what consistency is. Muscles are not built in a day, they are built over a period of time. You need to build it, you need to work on it. You have to start taking small baby steps. Don't beat yourself up. Do not go with heavy exercises on day one, because if you do that, then you will be resting for the entire week or probably get injured. What I say is, do as per your physical strength, yatha shakti, how much ever your body is permitting. Listen to your body. This is all what you need to do. So go slow. You have just recovered, so take it easy. You could start with 10 minutes and move to 90 minutes as per your strength, and if you like it, you could do more. It's all your choice, but stay consistent. Consistency is the key, and it brings result and help you achieve the desired goals. So after surgery, chemo, radiation, there are certain limitations that have cropped up. You need to also understand them and make those limitations a powerful tool for yourself. Target them and stay focused. Trust me, you've got this. So our liver, kidneys, lungs, and pancreas, and all these digestive organs have been doing a lot of work over these days and have been under tremendous stress. As I said earlier, these organs are continuously removing the dirt, the toxins which have been created due to medication. So you need to nourish it with the right fuel. Don't overburden them by giving it smoke or alcohol, because it takes a lot of effort to create that mess. Please take care on these small little things which are absolutely important, yet effective. So a very neglected area, again, when it comes to wellness, when it comes to gaining strength, is also other than food and exercise, is also your breath work, the way you breathe. So our lungs are a primary source of oxygen. Everybody knows that, right? And which is regulated by it actually regulates the entire process in your body from gross to subtle level. From your lungs, it goes in your bloodstream. Your lungs, the oxygen is circulated in your bloodstream, it gives to vital organs. From there it goes to the cellular level. So see how important it is. And if the breath work is wrong, you will not have energy to exercise. So during exercise, also focus on your breath work, because from skin to cellular level, we need that oxygen, we need correct way of breathing. It is very, very important. So work on correct pattern of breathing. And so there are various breathing techniques that have always been discussed, and you have been seen listening to people, a lot of speakers talk about anulom vilom and box breathing and kumbhak therapy, which has been excellent in controlling and in fact even in remission of cancer cells. So the very, very basic and very important thing is just breathe correctly. A lot of us, because of the physical stress that we have gone through, and also generally because of the fast moving lifestyle, have not been breathing correctly. Inhalation and exhalation have to be equal. It has to be equal. So if you inhale in 2, exhale in 2. If you inhale in 3, exhale in 3. Also, there is something called accumulation of the carbon dioxide in our body, in our lungs. What happens is, because we are not exhaling well, our body is not removing that carbon dioxide from the body. It is trapped, usually trapped in the lungs, and it is doing nothing basically. And that area of our lungs is occupied by that carbon dioxide, and as a result, we are not even able to breathe deeply. We are not able to inhale deeply. So what we need to do is work on those 3 muscles of your lungs. Now there are 3 muscles. One is diaphragm, which is lying just below your lungs. It goes down and up as you inhale and exhale. Okay, so one is that. Second is your thoracic cavity. There's something called intercostal muscles, which are near your ribs. You need to move them as well. So when you inhale, those intercostal muscles open up like this, and when you exhale, they go like this. So these muscles also need to be utilized, because it ultimately adds to the total breathing capacity of your lungs. And the third muscle that is involved in breathing is here, your clavicular muscles, the place where your collarbones are. The muscles just below that are also assisting in breath work. So you need to, this is when we are shallow breathing, we use only these muscles. So we need to use all these 3 muscles, the diaphragm, the intercostal muscles, as well as the clavicular muscles. And that's when you're going to use the entire lung. Okay, so first, equal breathing, balance your inhalation and exhalation. Second, use all these 3 muscles. Also, one of the very, very I would say interesting as well as easy technique is belly breathing. Now we spoke about sleep, right? Now a lot of people are not able to sleep well. What we could do is, when you're lying down on the bed, fold your knees, join them together and keep your feet apart, and keep your one hand on your abdomen. Now observe your breath. Now when you inhale, your belly should go up, and when you exhale, your belly should collapse like a balloon. How the balloon is, same way your belly should also go up and down. And if you keep on observing this kind of breath, you will realize that the mind chatter in the mind has gone down. So your mind is under control. Your sympathetic and parasympathetic nervous system is again getting balanced. Okay, so that is another thing that is happening. Also, you are getting now in that relaxation mode where you are going to fall asleep. So again, ek pant teen kaj, you are able to get 3 things out of that one thing that you're going to do, one exercise, one breath work that you're going to do. So try that. Now people who can, they can also move on to kumbhak. Kumbhak is basically when we inhale and exhale, there is some kind of retention that is happening in your body. So there is a process that you could use is, say for example, if you inhale in 3, you could hold your breath for 6 counts, then you exhale for 12 counts, and then you hold your breath again for 2 to 4 two counts. Actually that should be sufficient. For hold your breath for 2 count, and then as in hold it, as in stay in this mode of suspension where you're not neither breathing, not inhaling, nor not exhaling. It is a complete state where you are empty from inside. Now what will happen here is that your lungs will totally excrete out entire carbon dioxide. Your abdominal muscles will also get a lot of massage, which is very very important, because ultimately all diseases start from your stomach, your gut. And when the muscles, and because of chemo and radiation, the muscles of abdomen are becoming very very weak, they become weak because of the side effects. So when you're exercising your abdominal muscles, your muscles are also working better. The motility in the intestines and the stomach and the gastric acids, it all improves. So all your issues related to constipation could be solved, the digestion can be solved, all your issues related to all of that, if you're giving the right fuel to the gut, you're giving ample exercise to your abdominal muscles, automatically your body will start feeling better. There will be a force of energy that will circulate throughout the extremities, your legs, your hands, your lungs, your heart, everywhere, your mind. And slowly you will see improvement in your own well-being. Also, if I go a little bit in detail, our bodies are made up of nadis. Ayurveda says that there are some 72,000 nadis in our body, which go, they are crisscrossing the entire body. And there are 3 nadis that are actually regulating the entire prana shakti, the entire energy systems in our body, which are called Ida, Pingla, and Sushumna. So Sushumna is the one which needs to be clean. So Ida is the left, and Pida is the Pingla is the right, and Sushumna is the center, which goes through the spine. So they all spiral through the spine, and the Sushumna is the one which goes straight up. Now, when these Ida and Pingla are balanced, the Sushumna also becomes balanced, and there the circulation in all these nadis will improve. So see how from gross to subtle level you are getting energy, you are getting strength, and that is how your body is going to get strengthened day by day. Okay, so we need to focus on this physical, mental and emotional strength. Only then you'll be able to get your health back. And to end, I would say that focus on yourself, focus on your own true self. Be truthful to you don't have to be in a state of denial or self-sabotaging. No, it's all okay, it's all good, you've got this, right? So be truthful to yourself, be kind to yourself. Also let go of the things that no longer serve you, because this is you, and something that is not nourishing you shouldn't be there within you. Let go, just leave those, detach yourself with things that are not no longer serving you. Also practice some basic rules of hygiene, like using the washroom regularly, cleaning the mind with positive and keeping positive thoughts inside. So if you remove negative thought, there will be ample space for putting head. Do that. Add little bit of contentment. Why me, why I don't have. See, you, again I will repeat, you are not the one who's running the universe. You have to be very strong so that you could do your duties well towards yourself. and your loved ones, and then you'll be fine. Okay, so at the end of the day, what you need to do is just surrender. And I will not say that lose hope. No, losing hope is not the thing. Just do your best, and you will soon regain what you really deserve, what you really have to get. And I'm sure you're going to get it. There is uh, no second thoughts to it. So that's how I think I should end. Yeah, over to you.
Yeah, thank you so much, Vartika ma'am, for the informative session. So I hope many of them might have to ask some questions, and also if anyone want to ask some questions, there is not much time left. So Rajendra ji, would you like to say something about today's session?
Yeah. The man, I forgot the name. What is the name of the man? I joined later on.
Vartika.
Vartika. I think she spoke well. Only one thing I wanted to ask her, that it's very difficult to control the thoughts of the mind, whatever we do, because I do meditation, I do exercise, but even then it is very difficult. Maybe it could be an aging process or what. So many thoughts are coming in the brain despite doing all these things. So what could be the solution?
See, first of all, Rajendra ji, we all say that we meditate, but if you're able to, meditation is what? Prolonged concentration. Okay, so if we are able to hold on to our thoughts for at least 12 seconds, also we are in a state of meditation. So in yoga we say it's dharana, dhyan, samadhi. So dharana is 12 seconds, 12 seconds into 12 seconds is dhyan, and samadhi is 12 into 12 into 12. So if you are able to concentrate and meditate for at least 30 minutes, then you are in that sahaj samadhi state. So first of all, what we could do is here to bring back the attention, to avoid that, could just observe the breath. Just focus on your nostril, the tip of the nostril, and observe the inhalation and exhalation. Just do that. At least your mind will be in a state, I would not say in thoughtlessness state, because again thoughts will keep on coming only. But if you're observing something else, your mind will be away from those thoughts. So to start with, this is something that could help. Then slowly you will eventually go in that state where there are no thoughts coming. But this is again a matter of practice. It doesn't happen in one day. You'll just have to be consistent with your efforts. So to start with, keep observing your breath. Feel the warm air going in and cold air going in and warm air coming out. If you could feel that also and be aware of that, I think you will be on that path of meditation where mental chatter would stop. I hope I answered your question.
No, what you say is very right. But the problem is there are two factors. One, that I have passed through the journey of cancer for a period of 1 year. That's correct. And naturally, anybody would go into depression during that time because of the pain which we suffer, the thought of death, and all these things are there. And the depressive thoughts will always be there. But suppose that phase has gone. Another is aging. As we grow old more and more, so that certain brain hormones, what you are referring it to, melatonin or serotonin or dopamine. I think probably some of my doctor friends were suggesting that automatically get reduced because of the aging process. So obviously, when we age, I think our sleep is becoming bit limited, and getting sleep also becomes difficult. So any such good idea, what you practicing meditation, what you are referring is okay, good. I am doing exercise also regularly, but even then, getting sleep is becoming very difficult.
So then I would refer to the circle of life. Let's talk about relationship. Let's talk about joy. Let's talk about creativity. Let's talk about fulfilling all these areas of life. Are you able to fulfill them? If not, then try and fulfill these areas, because that's where we feel very content. See, there are some changes that happen in our body as we age. Like, even I am growing old, so my metabolism is going down and I need to work harder for that. So this is a natural phenomena. What we need to do is here accept this natural phenomena, but at the same time we could look at these different aspects of life as well, where we need to find things that will fulfill these needs of our well-being, of our health and happiness, right? So I can share that circle of life through ma'am, and you could see that, what area. So what I usually suggest is, take a pen and okay, would you allow me to share my screen? I can show you right away. Yeah, give me a minute.
Yeah, you can.
Can you see my screen, Rajendra ji?
Yes.
Can you see my screen?
Yeah.
Yeah. So see, these are all the areas that nourish us. Okay. There is joy, spirituality, creativity, finances, career, education, social life, all of these areas. Now what happens is, if you take a pen and start plotting. In the center there is 0, and on the edge there is 10. Okay, on the scale of 0 to 10, start plotting around it.
Right.
Okay, and when you start plotting, you will realize that, okay, ये area में काम करना बाकी रह गया. So let's focus on that. Now again, sleep. You There is something that is aging. This is the process of aging, and we can't really fight that. We need to surrender to that. But also, when it comes to mental wellness, when it comes to our own well-being, to having a very contented and satisfied life, we are constantly working on these areas. Okay, so what we could do is pick any area and work on that and see, how you're progressing on that, right? Because everybody has it. Come on, it's not perfect. Nobody is perfect here, right? What we need to do is work towards progress. Keep motivated, keep yourself motivated, stay in that positive frame of mind. These things will also keep you occupied and give you more motivation to do better. I hope I answered your query.
Nice. It is true. What this circle, what is representing, is also very nice, and I'm very happy about it. Only I'll be trying, because I have got lot many hobbies. I'm very creative, remain happy also, singing, meditation, everything I do. But this particularly, even I have tried. That's why I was suggesting whether any extra thing to be taken, melatonin tablet. Recently, I started. Whether is that
Huh.
will or not. Otherwise, I'm creative throughout the day. I don't have any other problem also. Being
So then
happy,
why worry? It's
sleep.
all okay. It's all normal.
Talking about the sleep aspect, it's okay. All other things are okay. What you even refer to, and especially
It's
this
all okay. It's all normal. This is a process of aging.
right.
This is all
Okay.
okay. You're all okay. You're doing good. I mean, you don't need my validation.
Yeah,
You're just
remaining
doing good. You're fine. You're
nice,
just
nice.
fine. I mean,
Good.
what is your worry? I don't think you when
No,
you're saying everything is going well, then perfect. It is. See, again, there are certain things. Our hair will gray. I mean, we'll lose some strength. This is the process of aging.
yeah,
This is the process of it. This has to do nothing with, say, cancer or any kind of disease. This is a process. What all we could do is just work around this and take it, accept it very gracefully. Nothing is permanent in our life. Nothing is permanent.
That's true, but there
Just
is some hidden fear when we go through this underwent through a typical thing in life, very difficult post passage in life. So some hidden fear is always be there, whether shall this recur or what will happen in future. All these things, whatever we say, yes, we should
I'm
try,
sure. I'm
but
sure.
then this thing happens. Otherwise, very nicely explained. Thanks a lot. Congratulations. I
Thank you so
appreciate.
much. Thank you so much. And you are doing good. I think you are one of the warriors. You are, I mean, I think क्या है ही आप तो है ही. Thank you so much.
Ma'am, I have a question.
जी
Hello.
रितु.
Yeah. Ma'am, you spoke about equal breathing and the utilization of the three important muscles. So, what are the basically these proper breathing exercises? I would like to know about that.
Okay. So what I can do is I can make you do. I think somebody's mic is echoing. Rajendra ji, can you please mute yourself? I think echo
I
is
will.
coming. Okay. I think now, yeah, now
Ma'am, can you share some pictures so that
I'll
we
make
can
you do right
understand
now.
better?
I'll make you do right now. Can you switch on the camera so that I'll make you do? You'll realize it better.
Yeah. Okay. One second. Yeah, I'll do it. Able to do it right now. I'm clicking
Okay.
on start video, but
It's all right. It's all right.
there is some issue. There is
I'll
some issue.
demonstrate. I'll demonstrate, and you see. Okay.
Yeah.
1 second. All right. So what you could do is when we talk about clavicular muscles. Now there are collarbones here, right?
Mm-hmm.
You can keep your hand here, below, just below your collarbones. Close your eyes and observe. You don't have to take any extra efforts.
Mm-hmm.
Just observe. There are muscles that move here.
Mm-hmm.
Okay. So this is clavicular muscle. Now there is here near the ribs. The muscles over here. I think I should stand and show. Yeah, the muscles here. Okay, so these muscles are your intercostal muscles. So when you inhale, those muscles will expand, and when you exhale, those muscles will contract like this. Okay, so these are intercostal muscles. When you inhale and exhale, it will look like this. Okay, and then one is abdomen. So when you use all of these three muscles, you are using the complete lung. Okay, now coming to equal breathing. So what you need to do is take a normal breath, inhale and exhale. Now inhale at 1, 2, 3. So one में stomach पे गया, like how a pot is. पहले नीचे पानी जाता है, then there is water in the middle level, and then the water comes at the top level. Correct? Same way, you are first filling your belly up, then your intercostal muscles, and then these clavicular muscles. It is a matter of practice, but it will happen. You will soon realize. So what you could do is isolate first this practice. First do stomach only, intercostal, and then clavicular. ये तीनों में पहले feel करने की कोशिश करो. And once you start feeling it, then practice that this is like a pot. Your lungs are getting filled with air, and they are removing the air. Okay, so you could try that and see how it works. All right, Rituji, did I answer your question? I think she can't hear me. All right, I think,
Yeah, I think it's time for winding up.
yes,
Thank you so much,
yes, let's
Vartika,
wind
for
up.
today's session. It
You're
was really
welcome.
informative.
Thank you. Thank you.
Thank you so much, everyone, for being part of today's session. So for next week's session, I'll be informing you very soon. Thank you, everyone.